Akinetopsia. What is it, you might ask? The definition is a deficiency in the ability to see movement progress in a smooth fashion. Instead, the visual information is perceived as still frames rather than continual motion. Why might this be a problem? This creates an inability to keep up in the world we live in that is constantly in motion. This could range from minor annoyances to more impactful functional complications, such as pouring liquids, recognizing facial expressions, crossing the street, driving, or performing reading or writing tasks. What are the causes of akinetopsia? Well, studies have shown us that damage to the medial temporal region, or V5, as well as damage to the medial superior region, damage to the parietal occipital junction, or the temporal occipital junction, could all be responsible. This damage could be unilateral or bilateral in nature. How do we know what we know? Beginning with RAMACHANDRAN's Chapter 4 of Phantoms in the Brain, he discusses a patient he refers to as Ingrid. Ingrid suffered bilateral damage to MT V5 region. She was still able to recognize faces and objects, as well as complete reading tasks, although she could not see people running, see cars moving, pour liquid with correct timing, or see facial expressions during a conversation. All of this made it hard for Ingrid to function comfortably throughout her daily tasks. Article 1, entitled Electrical Stimulation of the Human Homologue of the Medial Superior Temporal Area Induces Visual Motion Blindness. This article was taken from the Journal of Neuroscience. This study used fMRI imaging along with electrical stimulation to the MT and MST regions during a patient-awake brain surgery. The surgery was being performed to remove a left temporal tumor. Cortical lesions that were reported were in the temporo-occipital junction. fMRIs were taken both pre- and post-surgery for comparison. Electrical stimulation, both to the MT and MST regions, interrupted the visual motion discrimination. MST and MT both house direction-sensitive neurons that are used to study motion perception. Visual motion discrimination is largely observed in the contralateral visual field, although stimulation of the MST also affected the ipsilateral hemifield due to the larger flow of stimuli directed to the MST region. Lesions to the human medial temporal area as well as the human medial superior temporal area have not been studied separately due to their close proximity. Article 2, Akinetopsia, Acute Presentation and Evidence for Persisting Defects in Motion Vision, was found in the Journal of Neurology, Neurosurgery, and Psychiatry. This article reviewed two case studies. The first, a 60-year-old woman who reported global visual motion detection disturbances due to unilateral damage to the parietal occipital junction. In this case, there was no damage observed in V5. Patient 2 was a 79-year-old man who had suffered from a left posterior hemispheric stroke at the age of 56. The damage in this patient occurred in the left hemifield specific to V5. This caused disturbances to the right visual hemifield. In both cases, the akinetopsia resolved, leaving visual disturbances to normal tracking eye movements. Article 3. The contribution of LM to neuroscience movement of vision was found in the Frontiers in Integrative Neuroscience. In 1983, Dr. Zoll published an article on motion blindness and patient LM. This was the first documented case of motion blindness in a human. LM had bilateral damage via cerebral vascular lesion in the cortex just outside of the striate area. LM participated in 12 studies over 17 years. These studies, some of which were identical, with near identical results, provided insight into a very specific visual disorder. Testing on other visual perceptions concluded normal functioning in color perception, depth perception, shape recognition, and ocular motor functioning, although she did report difficulties in reading and writing tasks. LM's damage was very specific to the V5 region. Because of the specific and selective nature of her deficits, LM contributed greatly to the study of visual movement perception, specific to structure and function of the involved areas. Further studies will continue to expand our knowledge of the structure and function of specific brain areas. Here I have a list of references if you're interested in further exploring this topic.